All right. Good morning, everyone. So a home, it should be a healthy place, a location where you can have a great meal with family, do your homework, enjoy a board game, and it's where family can be family. But you can't do that in full if it's not a healthy place to be. And what we've seen is that we've had our first increase in childhood lead poisoning in more than a decade. It's gone up by about 15%, and largely that can be attributed to the fact that people are staying at home. Kids have had to do distance learning. And if you are in a home that has some form of lead contaminant, you're far more likely to get lead poisoning. And if you get lead poisoning, that can lead to a whole range and host of problems, from cognitive disorder to a number of different delays, things that are entirely preventable if we act. Around 3,000 kids in our Minneapolis public school system right now have been exposed to lead and have some form of lead poisoning, and there are long-term impacts for it. And so as a city, we feel that in conjunction with our community partners, we need to step up and we need to act. So we have invested in ARPA Phase 2 $3 million to make sure that we're remediating as many homes as possible, and we will become the first city in the country to chart a path towards ending childhood lead poisoning by the year 2035. We're not there yet, but this provides us with the necessary shot in the arm that we need to get started, to protect kids, and thus to protect our city. There's a lot of people that have been working on this over the last several years, and so this hasn't come to fruition just overnight in this ARPA Round 2. Big thank you to Health and CPED and Regulatory Services who have been working together to make this happen. Patrick Hanlon, Lisa Smested, Fordoza Omar, and Director Garnett Hachuli, thank you so much. Thank you also to our incredible community partners, many of whom are here with us. Today we have Ann Ketz with Urban Homeworks and Rochelle Menento-Paleska with Sustainable Resources Center. Your work is really making a difference for the health and safety for children in our city. So together we've really set these aggressive goals. Again, the goal is that we will be the first city in a country, The goal is that we will be the first city in the country to end childhood lead poisoning, hopefully by the year 2035. We've already set the plan of attack. Now we just need to execute it. So this is going to take a collective effort. It's going to take mayor, city council, all of our departments, and of course community advocates and nonprofits as well. And we're all at the table. That's what you see right now. And so first, I am proud to bring up our city council member for Ward 4, LaTrisha Vetaw, who is a real advocate and done some incredible work in this area. Councilmember Vetaw.
Thank you, Mayor. Good morning, everyone. My name is LaTrisha Vetaw, and I represent this neighborhood on the city council. I want to thank you all for being here today to talk about an issue that I'm very passionate about. Lead poisoning can lead to a lifetime of problems for children, learning disabilities, decreased impulse control, and increased aggression. We know that it is our Black and brown children who suffer most from lead poisoning. The good news is we know how to fix this problem. The solution is expensive, but it's actually quite simple. We just need to remove lead. That's it. We just need to remove it. Once it's gone, it's gone. That's a good thing. This is a one-time investment, and it will have a lifetime of positive ripple effects for the family who lives in these homes. Thank you, Mayor Frey, for including me and including the funding in this round 2 for the American Rescue Act proposal. You've made a long-term investment in our young people. Of course, the helicopter came over me. I also want to thank our... Oh, thank you, Mayor Frey. You see what happened, right? I was trying to give you that big shout out, and the plane is like, no. Thank you. No, thank you, Mayor. This is a huge investment. This is a huge investment for our city. And I also want to thank the city staff who has been doing such great work to make sure that this happened. You know, round 2 of these dollars is a big deal, and I'm excited that we're spending it in this way. And thank you to everyone who shows up in our communities to make a big difference. I think, okay.
Thank you so much, Councilmember LaTrisha Vetaw. We are presently in her ward, Ward 4. And by the way, childhood lead poisoning is disproportionately taking place here in North Minneapolis among our BIPOC residents. Now, the next ward over, in slightly nearer North Minneapolis, is Councilmember Jeremiah Ellison, who is super passionate about this particular issue as well and is going to be a true champion. Councilmember Jeremiah Ellison.
Thank you, Mayor Frey. And I think the helicopter's done circling. Just came out for you, LaTrisha. You know, I really want to give it up to our staff. Patrick and his team, CPED, Mayor Hanlon and his team really have done a lot of work to educate elected officials about this issue. I know that I've been hearing about lead poisoning for years prior to even running for office and getting in office. And, you know, one of the things that I asked when I got into office was, well, how do we find out? How do we find out who gets poisoned? And the team said, well, you know, historically, when a kid is having adverse effects from lead poisoning, that's when you find out. And I think that one of the things that our staff has done is that they have worked diligently to educate elected officials and the public about how to make sure we can get ahead of this problem, how to make sure that we're not using our kids as lead detectors in these homes. And so while it's really important that we put this funding, right, that's our job, is to put our money where our mouth is. Thank you, Mr. Mayor, for doing that with this ARPA funding here. Our staff are the ones who execute this plan that keep our community safe. And so I want to give it up to our staff, and I want to thank our community for fighting diligently for decades to tell the city, to tell the state, to tell the federal government, this is an issue that our kids are facing. You know, with that, I can't say anything else that the mayor hasn't said, that Councilmember Vetaw hasn't said. And so, again, thank you all for being here, and I'm excited to get to work.
Thank you, Councilmember Jeremiah Ellison. Really appreciate your and Councilmember Vetaw's work on this. You know, this is the kind of issue where the more you learn about it, the more passionate you get. You know, it's not like I, nor most council members, ran for office to begin with specifically to combat childhood lead poisoning. But as you learn about this particular issue and the drastic repercussion it has on a child, a school, and a community, this really matters. And someone who knows that this really matters is our head of environmental services, and Lisa Smithstead, who has provided a whole lot of context and analysis and helped to really get this program off the ground along with Mayor Hanlon. Lisa.
Hi, I'm Lisa Smestad, and I am the manager for the Lead Hazard Control Program and Healthy Home Program inside of the Minneapolis Health Department. And our mission is to stop childhood lead poisoning. And we finally have been granted the funds that will allow us to move forward to do this. So often our programs are designed to be reactive. We're very good. If a child has been lead poisoned, we're out there right away getting that house fixed and taking those hazards away from that child. But we need to get in front of it. And the only way we're going to do that is to inspect the houses and correct the hazards before a child's poisoned. And with these ARPA fundings, we finally will have the resources to provide to both homeowners and rental property owners the money to allow them to get those lead hazards away from their children. And so we are so excited to be able to work to prevent this terrible issue that impacts child's developing brains and has lifelong repercussions for their learning in school, for impulsive behavior, for developing ADHD, heart disease, hearing issues. Lead affects every part of the brain, and we are thrilled to be able to start removing this environmental poison from our housing. Thank you.
Thank you so much, Lisa. And next up, someone who's been a real champion of transitioning regulatory services and transforming it to be more resident-focused is Saray Garnett-Hachuli, our Director of Regulatory Services. Saray?
Thank you. Good morning, everyone. Really excited to work alongside of our council members, the mayor, as also CPED and health. They're leading the way. We know that lead is an issue. In my department, we're responsible for our housing stock in the entire city. the biggest question is, now we know this, what are we going to do about it? How do we stay on top of it? My team, Inspection Services, is fully engaged. We inspect properties for rental inspections. A lot of these incidents of child lead are in rental properties. So what we have done is we have embedded 2 inspectors that have been inspectors that have their lead assessment certification. They're working along with health. And on top of that, when we go into our properties and we do inspections and we recommend repairs, 65 inspectors in our inspection services have had certification with info on background on practices needed to repair, paint, and paint issues in homes that we know have lead, in those identified zip codes that we know. So now it is, as we move forward, we're incorporating into in the way that we are being, and also investing in our housing stock. We're stopping it so it doesn't impact our next generation, our future. So again, excited to be a part of this, really moving forward, being active in the issue. That is what we are doing. Along with health, we continue to work together as we evolve. This money was just invested, but now we have the people and the knowledge to do the work moving forward. So our goal is to make that goal by 2035, right? And we're gonna do it. And my team and Kelly Rose Jones has been a huge advocate. She is the Director of Inspection Services, and we're gonna make this happen. So thank you for the partnership and the opportunity.
Thank you, Director. Next, we're going to have up Ann Ketz, who's the Development and Real Estate Director for Urban Homeworks. All this work takes partnership and community, and Ann and her team at Urban Homeworks have been tremendous in that respect.
Thank you. Hi, everyone. As you said, I'm Ann Ketz, the Real Estate Director at Urban Homeworks. We are the ones that are going to be rehabbing and selling this house to an 80% AMI buyer after the lead remediation work is complete first. Urban Homeworks has a focus on housing justice, and we do that by providing and developing affordable rental and homeownership opportunities. Our homeownership work in particular, we have focused probably 90% of it in North Minneapolis. Heavily disinvested, predominantly BIPOC community, and we are working to reduce the homeownership disparity rate between BIPOC and white households. Part of that is providing safe, dignified, affordable housing opportunities to buyers at or below 80% of the ADM AMI, and folks that ideally live in the community and are looking for homeownership opportunities. The partnership with the city and the lead remediation work has been pivotal in being able to pass those opportunities on to the homeowners. And we've done a lot of rehabs. We know that most of these older houses have lead abatement work to be done. And so we really just are so appreciative of this partnership with the city, and grateful for the investment to further this remediation work that needs to be done all over our city. So thanks for everyone for being here, and thanks to Fardoza and her team especially for that great partnership.
Thank you, Ann, and thank you to the partnership. And last but certainly not least, we have Rochelle Menento-Paleska with Sustainable Resources Center. They've been a true partner throughout, and I certainly will be over the next 13 years before we reach the goal.
Thank you. Thanks so much, everyone, and thanks for being here. Good morning. My name is Rochelle Menento-Paleska, and I'm the Director of Education, Training, and Outreach at Sustainable Resources Center, which is a nonprofit organization dedicated to the advancement of healthy homes. We have a long-established relationship and partnership with City of Minneapolis, and I'm really happy for them and thrilled to be here also to share a little bit about what we do as a community agency to combat childhood lead poisoning. As a community partner, Sustainable Resources Center, we think of us as the we're the first level of defense, okay? We're out there doing grassroots work, and we offer free in-home visits to qualifying low-income families to identify lead hazards in the home, and we assist the families into enrolling into the City of Minneapolis's grant program. So you see this home, it's very possible that some of our staff went in and we assisted the families, we identified the lead hazards, and we were able to get the families enrolled into their lead grant program for lead remediation. We offer free lead testing for children and pregnant women from our Leady Eddy unique mobile unit. It's located right over there, and the Leady Eddy mobile blood testing van offers free lead testing, and it's a simple capillary finger poke, and we can get the results within 3 minutes. We also provide training and educational materials for families to get to know what is lead, what are the hazards, and what can families do to protect themselves from getting poisoned from their home environment. During my many years at Sustainable Resources Center, I have seen the devastating health effects of lead poisoning. I have worked with families living in inadequate housing and have consoled heartbroken families and parents who didn't know that their home had all these lead hazards. So this new funding is critical to protecting children from being poisoned and their brains being damaged from the lead-based paint. Through this impact of the new funding, the impact that it will have is that we will be able to test more kids in the community, do some more neighborhood testing if they don't go into the clinics. We'll be able to do more outreach, awareness, education about lead hazards and preventative measures. We're able to assist more families with the resources, such as the resources that the City of Minneapolis is receiving, and the grant enrollment. And ultimately, the goal is to rehab more homes, to keep our families and communities healthy and safe. Thank you.
Thank you. With that, we'll open it to any questions you might have.
How many houses are there in Minneapolis roughly that have lead paint in them?
Get an estimate here?
I can't tell you the exact number, but it's about 75% of the housing stock in Minneapolis,
75%
of the residential housing stock.
has lead paint in it, lead paint somewhere in the home.
Yes.
That's because that's the age of our housing stock, right?
That is completely related to the age of the housing stock because most of our housing was built before 1978 when lead paint was banned from being used in residential properties.
It seems like a pretty hefty goal.
It is a hefty goal, but we know the neighborhoods where most of the lead poisoning takes place. They're in the low-income neighborhoods. So we are focusing our resources to the low-income neighborhoods where historically the lead poisoning has happened because that's going to be the most effective way to end this. And then hopefully there will be additional education for all the other property owners because once you work with a landlord and a property owner, then they realize the hazards of lead and they can take that knowledge and use it to protect the families and the rest of the properties they own.
Could you say and spell your first and last name because you only have it on
Lisa Smestad, Lisasmestad.
And Lisa, if I could ask a question just for further clarification for everyone. So, granted, the lead is in some of the more higher income homes, but it's not nearly as extensive as the lower income homes, thus leading to the lead poisoning in children, or is that not correct?
That is correct because the more affluent homeowners are maintaining their lead paint. So it's when lead paint becomes deteriorated and starts chipping and peeling that it becomes a hazard for the children. It becomes accessible to the children. So keeping the lead paint intact, keeping a good coat of paint on it, which many affluent families do, is one of the key preventative measures.
If you live in a house that you think may have this problem, but you don't have the resources to deal with it yourself, kind of what's the process? How do we get it dealt with?
Call 311 and ask to speak to the lead program, or go online at health@minneapolismn.gov and reach out to us, and we will reach back to you, and we'll either come out and do an education visit, and we'll tell you about the resources we have, and offer them to you as appropriate to what we find on the ground, because every house is a little different.
Any other questions? All right, thank you so much.
Thanks, everybody.
With lead-based plumbing?
That is a potential, but we have never seen lead plumbing linked to elevated blood lead in a child in the 20 years where we've been investigating it, or that I've been investigating it. It just, fortunately, we have really good water and a state-of-the-art water system in Minneapolis, and we just don't see it.
Thank you, everybody.
Thank you all.